On a day when a new high in cases, 356, was reached in New South Wales, 7 weeks into a lockdown of Sydney. Let's start with Kieran's question to the Prime Minister on whether New South Wales should now lock down harder or whether, as New South Wales Premier Gladys Berejiklian appears to be saying, Delta is unbeatable.
Should Gladys Berejiklian lock down harder like Melbourne, or is she right when she says Delta is different, it can't be controlled?
I have always said very clearly that in the suppression phase, lockdowns have to work. Vaccines certainly support it, and Delta is like nothing else we've seen and is a complete game changer. But I want to stress something I said yesterday. To get to phase B, when we go into 70% of the country having been double dose vaccinated, the stronger we go into that phase, minimising the number of cases. You can't eliminate COVID. We all understand that, and no one's seeking to do that. That is not any government's policy in this country. But minimising those cases is going to ensure that we go into the next phase a lot stronger. You know, Australians have made great sacrifices to be able to get us into the position we have been in.
So the PM there saying that Gladys Berejiklian and her government need to get as close to zero as possible so that Australia can open up with the 80% vaccination, really putting the pressure on there. It's similar to what the Prime Minister told his coalition party room today, as I understand it. He said that too much work had been done to minimise deaths from COVID to just let the virus rip across Australia. Scott Morrison says he wants everyone at the table for Christmas this year. Given what's happening in New South Wales at the moment, looks a long way off.
You know, I want Australia to get to Christmas, but I want everybody around that table at Christmas time. And that's the seriousness of this issue, and that's the seriousness with which it's being addressed, I know, by the New South Wales government and our government. And we will do everything we can to ensure we achieve that goal.
Gladys Berejiklian, for her part, still stubbornly refusing to introduce tougher restrictions, although her rhetoric about opening up some things in August became September and October today.
What is it going to take? What are you waiting for to pull the trigger and further impose more restrictions, like a ring of steel, like a curfew? What is it going to take?
I think what we also have to accept is the basic fact that Delta is very different to other strains we've had. So policy positions that may have worked in the past aren't going to have effect with Delta. And that is something we need to accept. We need to accept this is a different variant and you need to approach it in different ways. And can I just finish my sentence on that one? So in relation to that point, based on the health expert advice, vaccination reduces your chance of spreading, it reduces your chance of landing in hospital, and it reduces your chance of dying. That's why a targeted approach in those local government areas with our vaccine strategy is absolutely key to seeing us maintain and reduce those case numbers.
The Premier said before that further restrictions won't work. The advice has come from you. Why won't they work? A ring of steel?
So look, I didn't take that from what the Premier had said, but the Premier... Oh, sorry. I didn't take that from what the Premier had said.
The direct word was they won't work.
No, I didn't. I'm sorry, this is a very important point. I was asked about specific actions and why they weren't taken, and I said very clearly that if we need to do more, of course we would, based on the health advice.
Health Minister Brad HAZZARD in New South Wales says one of the reasons numbers are going up is because you can't legislate against stupidity. Interesting comment. Why do we have criminal law?
But what does worry me, I have to say, is no matter what legal orders or what legal requirements are in place, you can't legislate against stupidity, arrogance and entitlement. People will still try and do it, which is why the Premier has made the point that we've asked in the epicentre at the moment of this virus, that is at Canterbury Bankstown, for the police to reinforce the existing rules. If people just applied the rules, if they complied with the rules and the law, and they applied an element of common sense and a modicum of decency to the rest of the community, we would be fine.
Scott Morrison actually asked today whether he should stage some sort of intervention in the handling of the New South Wales response.
I would caution you against over-assuming about what the powers of the Biosecurity Act do. The ADF can be there and are there, and they are most effective when they're operating under the lawful direction of the state government authorities, the police, because they're the sworn officers. And that's what the ADF are doing right now. And I'm very pleased that the New South Wales government took up that invitation for the ADF to be there, as indeed Premier Andrews did last year.
CHANT revealed later in a parliamentary committee hearing today that despite talk by the New South Wales Premier Gladys Berejiklian things could open up at a 50% vaccination rate in Sydney, the real figure is actually 70%.
Certainly, I'm very committed to the issues around getting our vaccine coverage up, but very much recognise that we need that 70% before we have too much of a discussion about what easing restrictions look like. But obviously there may be some ways in which, the community compliance can be strengthened with vaccine uptake. I have not provided specific advice about any restrictions I would be prepared to ease. It is too premature, and we certainly, with escalating case numbers, that is not the case.
Pretty telling comments there. Brad Hazzard, the Health Minister, then said the Premier was trying to up the vaccination rate and create hope with her 50% comments. One thing is for sure, you can't spin your way out of a pandemic. Yesterday marked a milestone day in the New South Wales outbreak. New South Wales has now had more cases in this outbreak than in the entire previous 18 months of the pandemic, and that's even hotel quarantine cases when they're taking 3,000 a week in there. Past the 5,000 mark now in this outbreak. Victoria had 20,000 cases in their outbreak last year. If it keeps going at 300 plus cases a day, who knows? So at this New South Wales Parliamentary Committee hearing today, New South Wales Chief Health Officer gave evidence similar to what the Premier has told people privately, that Berejiklian locked down as soon as Dr CHANT told her to on June 25 and June 26. That initially, at least, she followed the health advice. The Health Minister, Brad Hazzard, was quite rude here.
When was the advice first, on what date specifically was the advice first provided to the Health Minister on locking down?
Well, it's not that easy, Ms Sharp. I mean, I know you haven't been the Health Minister, but when you're in the middle of a COVID crisis, I spend pretty well every day here in the health building, and we discuss these issues. Dr CHANT, I mean, last night she rang me, I think, or I rang her at about 10 o'clock or 11 o'clock last night. We talked through the night. We talked first thing in the morning. You have an expectation that some document appears. No, it doesn't. It's a moving feast.
We are specifically asking for the date with which, two dates really. The date at which your public health team started to prepare for the need to lock down parts of Sydney, and on what date you informed the Health Minister of the need to do this.
So there was progressive range of restrictions put in place, and on the 25th we briefed, we acted quickly. There were already preparatory orders that have been previous orders that form the basis of the state home restrictions. And so on the...
But Dr CHANT says since that lockdown, she cannot talk about what advice she gave to Crisis Cabinet on locking down harder.
Would you be able to provide the committee with information on advice that you've provided for stronger restrictions since the beginning of the lockdown, and then be able to articulate to the committee which ones of those have been implemented or not implemented?
Look, I think the Minister's indicated that we've provided a lot of that advice through crisis cabinet processes, so I'm not sure that I can specifically release those information, but I can talk in broad terms, because I think every time we go to the press conferences, I articulate the concerns.
Brad Hazzard had his own interruption here as CHANT admits she has been advising for mobility reduction.
Minister, I'm just going to ask one question to Dr CHANT. Have you provided recommendations on stronger measures than what the Minister and government have adopted?
Can I just tell you, Dr CHANT gives a range of advice which is discussed with the rest of the public health team and the health team here in New South Wales. And that advice then goes to the Crisis Cabinet. And involved in Crisis Cabinet is the economic issues, the mental health issues, the public health issues, the operational side. And so when you say...
CHANT also spoke about how the virus got out, that the New South Wales Health contact tracers failed to spot cases in the southwest out of a West Hoxton party. Gladys Berejiklian claimed today that in some suburbs almost 100% of people were vaccinated.
What Dr. Chant looks at and what the health experts look at is not only the rates of vaccination, but where those vaccination rates are. Some suburbs have nearly 100% vaccination. But if the virus isn't circulating in that community, obviously we're keen to make sure that we reduce the spread and increase vaccination in those communities that are especially vulnerable with the virus, and want to make sure that that's a priority.
Well, I've checked with federal authorities. This isn't correct. It's true in some North Shore suburbs in Sydney, like Ku-ring-gai, 100% of over 70s or over 80s have had their first dose, but not the whole population. The first dose rate in Ku-ring-gai for the eligible adult population is 59.5%. As for Victoria and their outbreak, we saw a rise in the number of cases identified today who were in isolation the whole time, about a quarter. So I'm told it seems unlikely we'll have an end to the lockdown this weekend, but it is headed in the right direction, Kieran.